back here on Carolina Women with our friend Hollie. Great to see you again.
Hi,
Last time we talked, you had a new service that was getting ready to be introduced.
Yes.
Voila, it is time.
It's time to drop it.
Yes.
So, yes, it's Bluffton Thermal Imaging. So we've brought thermal imaging back to the Holistic Wellness and Detox Center.
So
just in time for Breast Cancer Awareness Month.
Yeah, exactly. So talk to us about thermal imaging and why it's so important specifically this month.
Well, Breast Cancer Awareness Month, obviously.
Breast health? Yep.
Yes, breast health. But thermal imaging is so much more than breast health. It's so much more. It really is a full body way to monitor the health of your body. We can see images in the skin from the neurological impulses and lymphatic flow and blood flow, doing things in your body before you even have a symptom. So it's really a nice way to keep track on the patterns that are going on in your body and see what your immune system is doing before you may even experience any
Tell us
discomfort.
more about that would look like from a client point of view. What will that experience be? And then what are you viewing on the imaging?
We're seeing everything. So we're seeing thermal images in the skin. So it looks very much like the movie The Predator on the camera.
I love
that. But we see heat. So we see temperature variations in the body. So that's really what we're looking at. We're looking at symmetry versus asymmetry. If the right side of the body doesn't look the same as the left side of the body, sometimes there's a clue in there.
Could it be due to injury or just disease or inflammation?
Inflammation, we see inflammation.
So interesting.
Yeah, and we see the hot spots. So, yeah, and with our business, we really protect people's modesty and comfort. So everything that we do is behind a screen, whereas a lot of thermal imaging, you're just kind of sitting there in front of everybody or the technician. So we do keep you behind a screen and comfortable. So that's.
And is it a full body scan then, or do you, depending on the client, pick and choose?
We can pick and choose. Our main studies that we do are, we do breast. We also do what's called a woman or men's health study. So it's anything from the abdomen up. And then a full body, we include the arms, legs, hands, and feet as well.
So what are we looking for when you're doing thermal imaging on a breast?
We're looking for heat changes, patterns, and temperature on the skin. When there may be
skin.
So you're seeing it. The camera is not a camera; it's a sensor. So it's looking for temperature variations. So we can see congested lymph. So a lot of times you can see patterns of heat forming here, and sometimes there's a doctor that interprets all of our scans, and so they may come back in the report and recommend something like lymphatic massage or dry skin brushing to help clear that lymph. And so typically with that, we would see the client back in about 3 months and retake those images. And if that was the case and the lymphatic work has helped, you can see that area completely clear up. It's really amazing.
So
such a
you
great
all
tool.
do the imaging and then you send them out for interpretation. What's the length of time that is?
About a week.
Okay, so about a week. And so they come back. And then once you get that image, then what do we do?
We want to keep track. We want to see you back in about 3 months. The most benefit that we get really from the thermal imaging is the follow-up images, because once you
get a baseline.
Set that baseline, then you can watch. So you may see something that's just like, okay, that could just be a little inflammation. Let's just watch it and see if it evolves into something different or if it just stays the same.
So someone could be asymptomatic and come in and just do that just for their own knowledge to see areas that could be troublesome.
Yeah, health discovery.
More preventative health.
Exactly.
Absolutely. Yeah.
So tell us a little bit more about your ideal patient. Is it client?
It's a client. Anybody.
Sounds like anybody.
Yeah, if you have aches and pains, something that hurts. What's really interesting is that you can see patterns, because sometimes a lot of what we see is root canal. So people who have had root canals in the past, if there's something going on with that root canal, sometimes you can see where maybe that inflammation or lymphatic drainage is going down and connecting to other places in the body.
Makes sense.
We had a client this morning who forgot that she fell down a couple of weeks ago, and we were able to see, changes that could potentially be from that.
Were you
fall
like,
in
is
the
your
legs
knee
and
hurting?
Yeah, well, she forgot, and it's like, what's that on your hand?
Yeah,
I fell down.
Exactly.
Right.
Yeah,
Makes sense.
If people are interested, how long does the procedure take?
It's pretty quick. It takes about maybe 30 minutes. If you're just doing a breast health study, you're going to be here about 30 minutes. The imaging itself, we can do it in less than 10 minutes for just a breast. It's going to obviously take a little longer for a full
Hollie,
body.
it's great to talk to you, and we appreciate you talking to us here on the Holistic Wellness Detox Center. We thank you for joining us. Thank all of you for joining us here on Carolina Women. Bye-bye.